Hello, my name is Abdul Kaderi. I'm going to be doing my vaccine administration with assistance of my sister. I'm going to start off with doing my hand hygiene and setting up my sterile field with all my materials. So, hand sanitizer. I'm going to get my sterile fields all set up and gather my supplies. So I have my syringe, my 1-inch needle, sanitizer, cotton and tape for after, and some alcohol wipes. I have my vaccine inside the insulated bag just so it can stay cool and viable. I have my anaphylaxis kit right here, just going to keep that nice and close, as well as my biohazards container. So I have all my supplies ready, and I'm going to ask the eligibility questions to my patient here. Hi there, I'm a nursing student in second year. I'm going to be doing your vaccine administration today. Just wanted to confirm your name and date of birth.
Zubaydah Kaderi, March 24th, 2004.
Okay. Have you received the vaccine at all this year?
No.
Are you living or working in Alberta or going to school?
Yeah.
Yeah, good. So the eligibility portion is good. Confirmed all of those. Now I'm going to ask some more assessment questions just on their medical conditions, see if they have any allergy or anything like that. I have a few more questions for you. Do you have any, are you feeling well today? Do you have any symptoms?
Yeah, I'm feeling good. No symptoms.
Okay. No, you don't have a fever, right?
No.
No. Are you allergic to anything? Do you have any allergies?
No.
Have you ever had allergic reaction to a vaccine before?
No.
No. Do you have any medical conditions that requires you to visit a doctor regularly or recently?
No.
No. Are you on any medications regularly?
No.
No. Okay. I'm just gonna ask the patient as well if they're pregnant, because they're a female over the age of 10 and under the age of 40. Are you pregnant?
No.
No. Okay. So now I've asked all the right questions, all the questions. I'm going to move on to the educational portion of the process. So the vaccine I'm going to be administering today is going to be influenza vaccine. It's going to be 0.5 mils administered to your deltoid at the right or left side, whichever you prefer. The vaccine is going to go straight into the muscle tissue with the 1-inch needle, and it's going to consist in the vaccine is going to consist of 4 strains. So it's going to be 2 A strains and 2 B strains. A Darwin, A Victoria, B Phuket, B Austria. These antigens, these antigens are going to create antibodies in your body and allow your body to recognize the virus if you do come in contact. It doesn't prevent you from getting the virus, rather it just gets you a little bit more prepared, so your body recognizes the vaccine and you can fight it more effectively and efficiently and faster, which is the goal. So I just wanted to reiterate that the vaccine will not prevent you from getting the virus. It's just gonna be your body's just gonna recognize it, so you can fight it off faster and better, so you have less symptoms, hopefully. The vaccine, once I administer, it could cause a little bit of redness, swelling, or nausea. These are all normal symptoms. They will subside within a few days if you do get any of them. So when I do administer the vaccine, I just need you to relax and be nice and loose, so I can administer without you getting stiff after. As well, you would need to stay 15 minutes just so we can watch you for a little bit of time before you go home. As well, do you have any questions?
No.
Do you give me consent to give your vaccine today?
Yes.
Yeah? Okay. So now I've given all the educational portion of the vaccine. I'm going to head on to starting preparing the vaccine itself. So I'm just going to start with hand hygiene again. And my hand hygiene. I'm going to get my vaccine from the insulator right here, and I'm just going to confirm the vaccine. It's multi-dose so confirm the vaccine itself, make sure it's not visibly damaged or open or anything. I'm going to check the expiry date, which we're good, and the lot number, which I'm going to document. This is the vaccine. I'm going to show it to my patient, and also agitate a little bit just so the particles can mix and make sure it's going to be working properly. So this is the vaccine. It's an influenza vaccine. I'm going to administer 0.5 milliliters for you today. I'm going to start off with swabbing the top here. Swabbing the top here, and then so I'm going to peel the vaccine, the syringe here like that, and peel the needle, and take out the syringe and connect it to the without contaminating anything. I'm going to connect it to the needle. Now I have to withdraw around 0.5 mils, and then because I already sanitized that, I'm just gonna get a dose, a few seconds to dry, of course. I've inserted 0.5 mils of air into the vial, and now I'm gonna flip it and withdraw out 0.5 mils, and just gonna flick any air bubbles out. And then I have the vaccine ready. Just gonna recap that just until I can landmark and get everything. I'll return this to the insulator. And so before I touch the patient, I'm gonna do more hand hygiene. I'm gonna be landmarking on the patient. I'm gonna find the chromium process and find a few fingers below that, and that's where I'm gonna be landmarking. And I'm going to be administering the vaccine. So just a little bit more closer on my arm, I'm going to find the chromium process, which is the corner right there, a few fingers down, and approximately right there, I'm going to be administering the vaccine. So I'm going to take an alcohol wipe, and I'm going to be using an orange for demonstration purposes. I'm just going to swab the area I'm going to be injecting, the place I not landmarked. I'm going to give that a few seconds to dry. I'm going to do my hand hygiene. And I already confirmed the vaccine a few times and checked if it was the right vaccine. And I have prepared it right here. So I did my hand hygiene, and I marked my landmarked, and I'm going to be administering the vaccine. So I'm just going to go straight at a 90-degree angle, telling the patient to just relax their arm 90 degrees. I'm going to wait a few seconds. I'm going to, anchor the vial, the syringe, and a few seconds to make sure there's no blood drawback. And then I'm going to insert the vaccine, remove nice and slowly, and I'm going to throw this into the biohazardous container directly. So I'm going to throw that into the biohazard container, and now I just injected. Just going to put the cotton swab there and tape it up, just so, because there may be a little bit of blood after puncturing the skin. Go. And I'd just like you to wait 15 minutes, like I said, just so we can watch over you before you go. I'm just going to do some documentation. I'll get you a copy as well, okay? So once I'm done giving the vaccine to my patient, I will be doing hand hygiene once I'm done. And now I'm going to start with my documentation. My documentation here. So what I would write on my documentation would be the location where I'm giving the vaccine, so the date, so the clinic name if I'm in a clinic, or at the college if I'm at the college. I would also write the consent that the patient gives, the location where I administer the vaccine, whether it's on the left or right, and the deltoid, intramuscular, it's an influenza vaccine, 0.5 milliliters of the influenza vaccine to the right deltoid or left deltoid, and I would write the patient name. Well, the information should be there with their name at the top, and the date I'm giving the vaccine, as well as the time, my full name, and my signature. For this Oscars, I would be writing that I'm a second-year nursing student at the college, and I would write my instructor's name as well. So I would have all of that right here, and I would provide a copy to the patient as well, so they have record of it. And that's everything that I would do. Thank you so much for taking the time to watch this video, and have a good day.